Charlie, thank you. And I will tell you, I do have a major regret about this morning. And that is, I wish everybody in the United States Congress, everybody with an election certificate, could be here for this. This has really been an outstanding program. Let's have a little shout out for CED and Charlie right now, and a big thank you to them. And we're going to hear from my colleague, my co-conspirator, Senator Bennett, here in a second. I'm giving a little shorter talks as well on health, despite Charlie's kind words. Recently, I was home at a special program on health with seniors in Oregon. And when I was done, they all came running up and said, "Ron, great talk. Boy, are you good. This is a sensational talk. We've got to have it in the press. All of your remarks, Vanessa, all of them were supposed to be in the press." And they went on and on. I was so brilliant. This was so important. You know, it just had to be in the press. And I knew I hadn't said anything particularly valuable, and they were so insistent it be in the press. I finally said to the group of seniors, I said, "Well, folks, maybe the press will write up what I have to say someday. They'll write up my remarks on health care. You know, they'll write them up posthumously." And this very small older woman jumps right up and says, "Oh boy, Ron, with you, I hope that's really, really soon." So I'm giving short talks. And I want to pick up for just a minute. Lois and others talked about the basic proposition that bold is cheaper than incremental. We now have 2 studies on the Healthy Americans Act that show that, Lewin and the Congressional Budget Office. And I want to take a couple of minutes and talk about what I think bold really is all about. The first is starting with the proposition that for the most part, we spend enough on health care today, we don't spend it in the right places. That is proposition number 1 of bold. And to give you an idea how I come to that, this year we'll spend $2.3 trillion on health care. There are 300 million of us. Divide 300 million into 2.3 trillion, and you could go out and hire a doctor for every 7 families in the United States. You could pay the doctors $200,000, say you're going to take care of 7 families. Whenever I bring this up at a medical association meeting, they say, "Where could I go to get my 7 families?" Because we're spending enough, we don't spend it in the right places. So if you accept that, and that all this inefficiency is packed into the system, David has said this, I thought you might find interesting a question I asked Peter Orszag, who is the head of the Congressional Budget Office and an outstanding thinker, at one of our hearings in the Finance Committee. I said, what you're saying is that the system today is so inefficient that you're not going to contain costs until you do 2 things. 1, show workers what they lose out on in their take-home pay because of health care inefficiency. And 2, give them an array of new incentives to make a cost-conscious purchase. He said that is correct. And I think it's some of the most important testimony we've had before the Finance Committee. So that is essentially what Senator Bennett and I, with 15 other members of the Senate, 9 Democrats and 8 Republicans, are trying to do in health care, is to find a way to rein in costs and particularly start, and these are the words that we feel strongly about, by modernizing the employer-employee relationship. That's what we want to do, modernize the employer-employee relationship. Matt and others have talked to you about the history from 1948. Folks, there is nobody outside driving around in an automobile from 1948 in 2008. But yet in many respects, the healthcare system in 2008 isn't very different than it was in 1948. So the question becomes, how do you get from where we are today to this modernized system? And what Senator Bennett and I and a group of 17 senators have said is, if you're an employer who wants to keep offering coverage and you're an employee who wants to take exactly that coverage, we will make sure that you can do it. In other words, if you're somebody who says that the federal government can't organize a two-car parade, you don't want to have anything to do with anything new, we will protect your right to do that. But as part of this modernization of the employer and employee relationship, we're going to say that on day one, you will get to have private sector choices. You'll be part, Lois, picking up on your language, of a large group so that you'll have more clout in the marketplace. The insurance companies compete on the basis of price, benefit, and quality rather than cherry picking. And Dale Wolf is here, and he and others are in the vanguard of insurance reform. And it will be a very different private sector. Under what Senator Bennett and I envision, 250 million people, everybody who's not on Medicare or in the military is going to have private sector choices. But they will be different private sector choices. The companies, the insurers compete on the basis of price, benefit, and quality, and not on cherry picking. And we think that's something that allows the kind of political digestive track, this question of people not wanting disruption, and if they want to keep what they have, to be able to do it, while at the same time modernizing the system. Second point I'd mention is that if you want to expand coverage without spending additional money, you can do it in a way that is good for the system, and that is by reforming the tax code that Matt and others have been talking about.